My name is Drew Welch, and I'm a family therapist here at Psych Garden. We encourage family therapy because it's effective. We use three modalities. The first being craft, which we use in a couple of different ways. Craft is an evidence-based practice that what it stands for is community reinforcement approach family therapy. A lot of times families will contact us when they have a family member struggling with mental health or addiction problems, or both, and they're not interested in services. So the family will come to us and learn tools and effective ways on how to communicate with their loved one, on how to persuade them into treatment. Once the patient is in treatment, then we continue the community reinforcement approach by rebuilding the trust that was lost. The second modality that we use is the family meeting. This is generally facilitated by the therapist. When the therapist recognizes that a family is an important part of the patient's recovery, we bring the family in to solve problems and reach goals. The family meeting is generally time limited. It's very focused on problems and goal setting. Usually what we find is the goals are the same. Everybody wants to be happy, everybody wants to be independent, and everybody wants to be safe. It's reaching those goals and the problems that get in the way of those goals is where the therapist comes in to teach skills on how to communicate better, set limits, and to compromise. The third modality is family education and support. We use this when the patient is already established in treatment and the family is supportive, and the family wants to learn about the patient's treatment and what type of supports they can offer. Example, if the patient has depression, the therapist will give education on the types of medication, the types of treatment, the types of approaches that we're using to treat that depression. So that would be the educational piece. The supportive piece would be the patient discussing what it's like to have depression and what it is that the family members can do while they're having those symptoms. As for the family, they can talk about what it's like for the family members to feel helpless. Family education support is ongoing, and it could go on for as long as needed because treaters change, but the families don't. I have years of experience utilizing these three modalities and teaching others.